Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County ADAMH, Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello friends, and welcome to Fairfield Today. I'm Paul Jasson. Nice to have you with us today as we broadcast and telecast from the lobby downtown of Fairfield Federal. We appreciate your being with us today, and we hope we have an interesting and a show that gives you something to think about as we move forward. As we tape today, it's a kind of a cloudy fall day, and it's cool, so we know that the weather, the seasons are changing, so we'll keep an eye on that. Our first show today is an organization I haven't had much contact with on the show, so it's a pleasure to do that. And let me tell you a little bit about them, just a little bit. It's the ADAMH board, which is about 50 yards across the street from us as we speak right now. But the ADAMH board, what they do, and this is their mission, it's on their website, good website, says to promote healing, support recovery, provide prevention and treatment services of mental health and addiction disorders within our community. That's a lot of words. That's a word salad as far as I'm concerned. So if you're like me, maybe you don't know what the ADAMH board does and what they stand for, and they've got some big news that we'll talk about in a little bit, but I thought it'd be the time to have the person on to talk about that, and that person is with us today. Marcy Fields is the Executive Director of ADAMH. Welcome.
Thank you.
Glad you're here.
Well, I'm glad to be here.
I figure if anybody can explain that, I hope it's you.
All right.
What exactly is ADAMH?
Well, I'm glad you asked.
Thank
because
you.
Many people don't know. ADAM stands for Alcohol, Drug Addiction, and Mental Health Services Board, and we are a county department. So we do serve all of Fairfield County, and it's our job to fund, plan, and monitor or evaluate behavioral health services in Fairfield County.
Well, about the only thing I knew about ADAMH is where you're located.
Yeah.
Because when I was a kid, that was the Kresge building.
Yes,
and Kresge
I've
was
heard
here
that.
when I was a kid. And then the Lancaster City Schools had their offices there for a decade or so, but they were there. And every now and then I'll see a levy that
Yes.
I've always voted for, but I never know what I really voted for. I just know it's a good thing, what you do. So and it passes, and so that's a good thing. So I didn't realize you were a county board. I didn't realize you were a county agency.
We are. Similar to the Board of DD, we have our own appointed board, so we're a little different than, say, the Utilities Department. Mm-hmm. We're a little more independent, but we are considered a governmental agency, so we're a public entity. And a lot of people don't know what ADAM is because we're the entity behind the curtain, kind of. Mm-hmm. We're funding the agencies in the community doing the services. And we actually have 13 network of care providers, which are our main agencies that we fund services with. And it's really changed over the years. I worked for the ADAM board once before in the late 90s, early 2000. And at that time, we did a lot of paying for clinical services. We matched Medicaid, so it was very narrowly defined what we did. And the planning piece of our job, we didn't do that much because we had to put this money into the clinical services. Now, with Medicaid expansion and more insurance opportunities out there, we've really been freed up to truly plan for our local community. So in the Ohio Revised Code, that's our mandate. We should be looking at our local community. We serve Fairfield County and only Fairfield County. So our job is to look at our local community, decide what we need, and then try to fund those services. So now we can be really creative, and we've got all kinds of grant-funded programs out there. We provide some funding to Big Brothers Big Sisters. We have some parent education groups at a couple of our agencies. We have we're just getting ready to have a brand new contract that'll help senior citizens in our community. Wow. So we have the whole age range. We have some prenatal support and coordination groups. So we really have agencies that serve from prenatal all the way, all the way through senior citizens.
What would be the program for senior citizens?
So we this month, so it's breaking news, this month in our board meeting, we'll be approving a new contract with Meals on Wheels, and they are going to have a support staff, therapists, clinicians that go into people's homes and provide senior support. So they can bill insurance and Medicare for the clinical counseling, but there's a lot that they do to support senior citizens that's not billable to insurance. Just that helping work with the family, being sure they're linked to the resources in the community, providing education, outreach, and those things aren't billable to insurance. So we're going to cover those.
So these will be the Meals on Wheels workers.
So
that
Meals on Wheels workers.
Some training.
Yes, so they'll be triaging and screening seniors that might be in need of some help, and then they will subcontract with some clinicians that will go out and go into the homes and provide those services. So if there's actual counseling needed, they'll provide that, but more importantly, we'll be paying for those extra support services that insurance doesn't pay for.
That seems like just a natural pairing with
Yes.
Meals on Wheels, who have access to mostly senior citizens'
Exactly.
homes and these people. So it'll be them that will locate the problem or see a problem and then perhaps focus on that.
Yes, and in fact, we did have this program once before with one of our clinical agencies, and they did work with Meals on Wheels, who would screen people and provide referrals. Unfortunately, in the behavioral health system, there's a real lack of workers right now. So our clinical agency had a hard time staffing it. So now we're going to contract directly with Meals on Wheels, and they have some clinicians really interested in doing this work that they'll subcontract with.
Sure.
And we'll pay for the extra support that insurance won't pay for.
Now, is this shortage of workers anything to do with COVID, or it's just a timing thing? It's just shortage right now?
Well, that's a great question. It has been a shortage for a while now, but COVID really escalated it.
Kind of exposed it a little
Yes.
bit. Now we are short.
Yes. So most mental health, counseling, behavioral health agencies are having a really hard time finding staff, and it's become very competitive. So they all are losing staff to each other and then having to rehire. So that's going to be a real priority for the ADAMH board the next year or two, is how we can help the system.
Did COVID enhance your services? Have you had more call for your services during or now perhaps post-COVID a little bit?
Post-COVID, definitely the demand has increased.
Okay.
I think during COVID, because so many people were in their homes and quarantining, honestly, our agencies had a hard time with demand. There wasn't as much demand, I think, because people had withdrawn. But as we came out of COVID, we kind of predicted that it would happen, and it did. Demand has really skyrocketed, and many, many people are reaching out for help. And we are working really hard with our agencies to be able to provide the services and the support to people that need it.
With Marcy Fields. Marcy is the executive director of ADAMH. Just we can turn around and see it. You didn't get lost coming over here today,
I did not. It was an easy travel.
Very, very good. So we're talking to her about that. But one of the things we really wanted to focus on was they had some big news. I just heard this a couple weeks ago from Mary Snyder here at the bank. Mary told me about this. It's called the STARLight Center over on 336 East Locust, which isn't really that far from here, a couple miles as the crow flies that way. This is big news for you.
Yes. Probably back in 2018, 2019, the ADAMH board did a series of community forums, surveys, talked to their providers, talked to the people they were serving in the general community. What's lacking in our system, and what really rose to the top was some form of crisis stabilization, something in that in-between world where somebody wasn't able to get the help or the safety they needed through just general outpatient services, but didn't really meet that criteria to go to the hospital in something that intense. So that really rose to the top. People said, we really need this in our community. And then soon after that ball got rolling, Fairfield Medical Center unfortunately had to close their 6 psychiatric beds, which made the need even greater to have something close to home.
Now what do you do?
Right. So right now, if anyone needs more than just your general outpatient going or having somebody come to you once or twice a week, the only real option is to go to a hospital out of our county. So most people go to Columbus.
Maybe.
Yeah. So I mean, it's far away for family. It's far away from the resources they may need connected to when they're discharged. And in some cases, they might not really need that high a level of care, but it's the only option. So that's what happens.
At Fairfield Medical, is that a staffing, money issue, something along those lines?
I think it was. I think it just became. Unfortunately, behavioral health services are hard to provide, and oftentimes providers end up losing money on it. And I think Fairfield Medical Center was wonderful to our community, continued that
They've always had that.
for years beyond, and they always lost money on that unit, and it was always a service to the community to keep it up and running. I think they got to the point where physically, they would have had to move the unit or do something drastic to continue to operate it, and it was a time where they had to discontinue it. Yeah.
So now we have the STARLight Center, which is, I guess, actually under construction right now. Do we have an ETA on that? When that might come about?
We hope to have it open. Well, we hope to have it complete and ready to open by the end of March.
Okay.
But it is under construction right now. Because our community said so strongly to us, this is what we need. We need some sort of stabilization center. Get moving on it. We did pass a levy.
I was going to ask, was this part of that levy?
Yes, it was. In fact, this is sort of what motivated the levy.
Yeah.
The fact that the community said we really need this. So the ADAMH board put a levy on the ballot, and the community passed it, which was really, really appreciated. So that's what we use the levy for. We're working on constructing it, and then of course we will also participate in operational costs because in Ohio right now there's not a great way to fund crisis stabilization through Medicaid or insurance. So the ADAMH board will have to continue to pay for some of the operational costs as well. But we're really excited about getting it up and running.
It sounds like it's a real need.
It is.
And it sounds like, sometimes governmental things can move slowly. I'm sure you know that.
Yes.
If anyone knows that, even though it's a great cause and we really need it, sometimes those things just don't move through the
Absolutely.
system. But it sounds like this. Once a need was found and sort of laid out there, how can we do it? It's kind of moved along now, and by March could be realization of this.
Absolutely, yes. We're very excited about getting it up and running. It did take a while to find the right location, to get the right plans in place, but it is on its way now, and we're very excited about it.
And as I understand it, this STARLight Center will be the only one that does what it does in the entire Fairfield County.
That's correct. We've never had this type of facility in Fairfield County. We'll be able to address both people with mental health crisis and people with urgent substance use needs. And we have never had that in Fairfield County, so this will be new for us, and will allow the people in STARLight Center to really get connected to outpatient services while they're there. There's a huge gap when somebody goes to Columbus for services or another county even further away, and then coming back home and getting connected to local services. A lot of times it doesn't happen because of the distance. But now being right here in the community, our outpatient providers can come into STARLight Center and meet the person, plan with the person, set up appointments, and we feel like that handoff and that connection to ongoing services once they're discharged is really going to be a lot stronger than it is now.
So to get connected to the STARLight Center after March when it's open, you come through the natural order of things through ADAMH, and then if it's appropriate, that's where you're sent.
Absolutely. We have two of our agencies will be providing services there. New Horizons Mental Health Services, who already is our crisis provider. They already have a mobile team in Fairfield County that's available 24/7. They'll go to the person who's in crisis. So they will also run the mental health floor at the STARLight Center. There'll be 8 beds there, and they can assess people. They'll have counselors, clinicians, peer supporters, doctors and nurse practitioners on hand there who can do a full assessment and decide what the person needs. And if STARLight Center is where they need to be, then they'll get them admitted, and probably for mental health, probably a 3 to 5 day stay. If they need something more than that, maybe their need level is higher than what STARLight can do, then they are able to facilitate moving that person to a hospital or a higher level of care that they might need.
Sounds like a pretty exciting time coming up
Absolutely.
over the winter and the spring,
Yes.
as you begin to gear up to open the doors in March.
Yes.
Pretty exciting.
Yes. And then we'll have Ohio Guidestone providing the substance use disorder treatment on the second floor. And they'll be able to do the same thing. They'll have nurses, doctors, counselors, peer supporters. They'll be able to do an assessment. And again, if the person has more medical needs because of the substances they've been on, they'll link them directly to a medical facility, and then they can come back to the STARLight Center. But if they're eligible and ready to go, they'll get them into the STARLight Center, and they'll provide up to a 30-day stay for people with a substance use disorder. And it's all voluntary. For the people coming to the STARLight Center are coming because they want the help. They've had a recognition that things aren't going well. I need an increase of help. I need more than what I've been getting. And so they're going to people that want to be there.
Well, it's an exciting time to kind of get doors open, get them moving. That's we're looking forward to that. Maybe we can get you back here after that's open.
Yeah,
we can
absolutely.
talk about how it's going and what the expectation level is. Sounds like fun.
Would love to.
Good. Marcy Fields with ADAMH is with us today, giving us an overview of ADAMH and about the new STARLight Center that will be opening next March over on Locust Street. So good. We hope the work on that is good and it continues to move
Yes.
along. We hope weather is in your favor there.
Thank you. We do too.
Thanks, Marcy, for joining us.
Thank you so much.
Sure. We'll be back on Fairfield Today in just a moment.